Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
In a world today, tens of thousands of people are dying every day from high blood pressure. It is believed that 2.1 billion people worldwide have this disease. And in the United States alone, there are 85 million people with high blood pressure. Do you have high blood pressure? Or do you know someone with high blood pressure? When was the last time you had your blood pressure checked? Do you want to learn about this disease? Well, welcome to Get Healthy with Dr. Cooper. My name is Dr. Cooper Dockery. I'm board certified in internal medicine. I have been practicing medicine for over 27 years. I have helped a lot of patients with their chronic diseases. I am here for you too. So don't go away, I'll be right back.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
If you have a cataract and it's interfering with your daily activities, then it's a visually significant cataract and we can do something about it.
Call now, 661-UC, that's 661-8733.
Welcome back to Get Healthy with Dr. Cooper. In our program today, I have a friend of mine, Dr. Andrew Levine. He's a specialist in hypertension and kidney disease. So Dr. Levine, welcome to Get Healthy with Dr. Cooper. Come right in, and I'm going to ask you a couple of questions, Dr. Levine.
Dr. Cooper.
Welcome.
Thank you.
Dr. Levine, tell us a little bit about yourself.
Well, I'm Dr. Andrew Levine. I'm a kidney specialist. In my specialty, I take care of hypertension, which is the topic today.
That's right.
And it's really amazing how in the world we have lots of issues with high blood pressure. As you mentioned, many people know or they don't know that they have high blood pressure.
But you know what? They're probably thinking, so what is hypertension? Why don't you tell us, how do we define high blood pressure and why do we have blood pressure anyway?
Yes, we have what's called high blood pressure, but actually it should be called high arterial pressure because that's what we measure, the pressure in the arteries. Mm-hmm. There is a way of measure the pressure in the veins, but commonly we just measure the arterial pressure. Mm-hmm. So,
is there a number, a cutoff number for high blood pressure?
Oh yes, absolutely. The normal pressure is 120 over 80, or less than that. When we measure two pressure, is one called the systolic pressure. It's the one that we measure when the heart contracts.
Right.
And when the heart relaxes, we call it diastolic blood pressure. Basically, that's what we have.
Is there a range? Because, you know, sometimes patients come to me and they say, doctor, my blood pressure is 139 over 90. Should I worry? Is there a range? Do we have normal blood pressure? Do we have pre-hypertension? Do we have hypertension? What is the range that they should worry about?
Well, that's a good question. The normal blood pressure should be the systolic pressure less than 120.
Okay.
And the diastolic pressure less than 80.
Right. So what if it's between 121 and 139? Should they be worried?
Absolutely. Should be worried because we let that pressure going for years. That causes end organ damage. I mean by affecting the brain, the heart,
The kidneys.
and the kidneys, of course.
Right.
Yeah.
So today we're going to explore a little bit about causes because the viewers might be thinking, so should I be worried? Am I at risk for high blood pressure? Why don't we walk over there and we're going to talk a little bit about the causes of hypertension. Come along with me, doctor. All right. So we're saying that hypertension, it should be about 120. I mean, normal blood pressure should be about 120 over 80. And then anything above that, we should worry somewhat. Am I right?
That's correct.
Okay. Now let's look at the causes. What are the causes of hypertension? Let's talk, Dr. Levine.
Well, there are some causes that we see. One is genetics. There are some races in human beings that have more blood pressure than others. Obesity is another cause.
Right.
You know, since I think for the past about 50 to 60 years, we indulge in not eating right, like preserved food and all that. So that can cause high blood pressure.
Okay, why is it that patients who are overweight have high blood pressure? Why?
Well, there is lots of causes on that, we can call it. Number one is they tend to not exercise.
Well, that's true.
You get obesity, your arm gets thicker. So there is more volume in your body. It has to do with fat.
Yes, and more volume in terms of blood. It is
That's
believed
right.
that patients who are obese have more blood volume,
That's
and
right.
they also have more resistance. So as the blood passes through the artery, there has to be more pressure. There's more pressure, and then that could be one of the causes for hypertension. What are some of the other causes? Patients sometimes are concerned about medication. Are there any drugs that could cause hypertension?
Well, illegal drugs.
Cocaine?
Cocaine, one of
That's
them.
right.
Is, there are some others, many, that people or humans being indulged into that can cause hypertension. But I think the one we have most the problem is cocaine, crack,
Steroids,
steroids,
pain medication.
pain medications.
We have to be very careful.
yeah.
I had a patient recently.
Analgesics.
Yes, right. Had a patient, young woman who came to my office recently, and she came with a stroke because of high blood pressure.
Yeah, well, we call it the silent killer.
The silent killer for a reason. Why is it called the silent killer,
Well,
though?
many people don't have any symptoms until
Exactly.
the blood pressure is too high. And then we end up with issues with the heart, you know,
Right.
weak heart, enlarged heart, issues with strokes.
That's right. As a matter of fact, I have something here I wanted to show. Now, we're going to simulate high blood pressure here. Now, I hope my cameraman can focus right on this experiment here. So therefore, if we simulate the heart, you said pumping the heart, pumping the blood gives the pressure. So when we push here, the blood should flow nice and easy. Now, when someone has very high blood pressure, what happens in the brain, for example, there could be, when the pressures increase, what we see, bleeding in the brain. You can see there. So there's rupture of the blood vessel and bleeding in the vein, in the brain. Many times, this is at this point the diagnosis is made. That is why it's called the silent killer.
Correct.
Because the pressure becomes high, the blood vessel ruptures, there is significant bleeding in the brain, patient can die or have paralysis. So this is a problem.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet.
Once I started to learn better nutrition, I benefited tremendously. I was surprised at the information that was brought out.
I could be healthy emotionally, physically, mentally. She's interested in my health.
For more information, call us at Cooper Wellness and Diabetes Center.
let's talk a little bit about, you know, treatment, for example. How do we treat hypertension?
Well, someone who doesn't have a very high pressure, so we check into the modification factors.
Yeah, lifestyle
like
modification.
Lifestyle modification, less stress, good diet.
That's right. You mentioned stress, right? How does stress lead to high blood pressure? Let's talk a little bit about that, because most of us are stressed. Am I right?
That's correct.
So let's see.
We actually live in a fast world.
Yes, with a lot of stress.
A lot of stress, financial stress, you know.
Family stress.
Family, living beyond our means, trying to catch up. This is a factor that we see even young people having heart attacks with high blood pressures and strokes.
So
we see it most so now.
Here now we have some of the causes here of hypertension. You mentioned obesity, you mentioned inactivity. What about alcohol? A lot of people don't know that alcohol can lead to many diseases, even high blood pressure.
Yeah, alcohol is a very interesting drug. We call it a drug. People tend to drink too much, excessively. So that causes many changes in the body. Alcohol is one of them.
Hypertension is one of them.
Hypertension.
And of course, people have some predisposition for hypertension, genetics.
That's correct.
But I always believe that genetics, your genes load the gun. However, lifestyle will pull the trigger. So even though someone is predisposed, mother or father have hypertension, if one lives a healthy lifestyle, then we can blunt the disease. Smoking. Smoking is also a big risk factor for many diseases, heart disease, cancer, hypertension. So if someone smokes, they should try to quit smoking. Let's jump over to salt. Salt is a big risk factor.
Since the invention of preserved foods, people eat a lot of lots of salt.
Right.
Definitely, most food have salt.
That's right.
And we always say that we should eat like 2 grams of sodium. That's basically less than a teaspoon.
Yes.
Not even a teaspoon.
Yeah, the max is just a teaspoon. 2 grams of sodium a day, I agree.
And most people eat 4 or 5 grams of sodium a day. That's
that is a problem.
Amount of sodium.
Right.
And that increases the volume in our body. And as a result, our blood pressure goes pretty high.
And we already mentioned stress. With stress, the body will secrete hormone called adrenaline, right?
Correct.
The adrenaline causes the heart to beat faster, pump the blood faster. That can increase blood pressure. So we have Adrienne on the road trying to get questions, because lots of people have questions about hypertension. Let us go then to Adrienne.
Once again, Dr. Cooper, I'm here with Ms. Jones, and this is what she wants to know.
I would like to know, what are the medical issues associated with high blood pressure?
All right, that's a very good question. What are the complications? Dr. Levine, you see this every day in your office. Tell us, what are the complications of hypertension?
Well, we start with our brain, strokes. And then we go to the heart can enlarge, and person can get a condition called congestive heart failure or thickened heart.
Right.
That the heart doesn't pump right. It gets to the point that it gets pretty weak.
Very weak, get dilated and just fail.
Yeah, we had issues with the eyes. You know, had hypertensive retinopathy. People can get blind from that.
That's right.
Other conditions, like in my specialty, kidneys.
Kidneys, here
Hypertension or high blood pressure is the second cause of kidney failure. Diabetes is number 1, hypertension is number 2. And most people with diabetes and hypertension, they got into kidney failure. In a way, with kidneys don't work anymore and
we need
require.
our kidneys, because a lot of people end up in dialysis. So we have to make sure that our viewers understand that hypertension is a problem and can lead to many diseases. Let's see if Adrienne has any other questions.
Hi, Dr. Cooper. I'm here with
Jaime.
He has a very important question for you.
Hello, Dr. Cooper. How do I know if I have high blood pressure return?
That's a good one. How do they know? We said it's a silent killer. What should they do to know if they have hypertension, Dr. Levine?
Well, it's pretty easy. You no need to go to a doctor to have your blood pressure checked, but now many pharmacies, even stores, supermarket, they have machines there or equipment that checks the blood pressure. If your pressure is abnormal, so you go seek to a doctor. Remember, if the blood pressure is over 120 systolic, so something is wrong with your blood pressure.
So therefore, they should make sure the number is about 120. All right, let's see if we have another question.
Hi, Dr. Cooper. I'm here with
Carlos Portales.
And he has another very good question for you.
What changes can I make to improve my blood pressure?
I want to answer this. What are the changes? All right. So therefore, there's so many changes one can do to prevent high blood pressure. One, your diet. Remember, we spoke about salt. Decrease the salt intake. That's number one. Remove caffeine from your diet. Remove alcohol. If you're overweight, lose 7 to 10% of your body weight. Exercise. Relax. Get enough sleep per night. There's so many lifestyle changes that you can do in order to prevent or even improve high blood pressure. Dr. Levine, it has been a pleasure having you here today, and I hope to see you again soon.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Welcome back to Get Healthy with Dr. Cooper. We are in the kitchen segment, and I have Chef Edgar. Chef, welcome.
Hey everybody, how y'all doing? Welcome, welcome, welcome. We have an exciting day for you all.
Very good. We have been discussing high blood pressure, the silent killer. And we have some superfood for you today that will indeed lower your blood pressure. What do we have, Chef?
Today we're gonna have our spinach and kale green smoothie.
That's right, spinach and kale smoothie.
Yes, it is.
Are you gonna add anything to that, Chef?
We're also going to add an apple, water, and our special Cooper Wellness protein.
That's right. Now, spinach and kale contain lots of folate and lots of vitamin B. This is superfood for the brain.
Yes, ma'am.
You know that?
Yes, ma'am.
And not only that, these green leafy vegetables have nitrates. Nitrates will increase the nitric oxide to dilate your blood vessel and lower your blood pressure. Chef, why don't you go ahead?
Okay, let's start. We have 1 cup of spinach, okay? We have 1 cup of kale as well. We have 1.5 cup of water, and we have 1/2 cup of ice. We also have an apple. This apple, we are going to leave the peel, but only thing that we're gonna take out is the seed and the core from inside, okay? So we're gonna cut these in 4. Very simple to take out the center part, put it in an angle, and we're gonna get that center out, okay? Get the seeds out, get the stems out. We're gonna leave everything else in there.
And you know, apples are filled with vitamin C. So if you do not want to get sick and to build your immune system, then all of these vegetables and the apple contain good vitamin A, C, as well as E. Go ahead, Chef.
Now we're gonna put all of this into our blender.
There we go.
So we get our spinach and our kale.
Are you gonna add the ice first, maybe?
The ice and the water. Get our liquids in there. If not, your blender will not mix correctly.
Yeah.
So get our liquids in there. Now we're gonna put our spinach.
Now, if you don't want to have osteoporosis, spinach is what you need to consume because spinach is high in calcium. All right, Chef.
Now our kale will go in there. We're gonna mix our greens up, then we'll add our apple, and then we are going to add our protein as well.
That's right. And remember, here at Cooper Wellness Center, we have plant protein for you. All right.
Here we go.
Excellent.
So now we have everything going. Now our apple is going in. There's no seeds, there's no stem, there's no core, but we get all those nice vitamins that we need. We're also going to add 1 cup of our protein vanilla flavored. This is a plant protein. This is awesome for your body. This is especially what you need.
That's right. And there are 25 vitamins in that 1 scoop of plant-based protein, which you can obtain right here at the Cooper Wellness Center. All right. We have it online, so if you're not living in the Rio Grande Valley, you can find us online at cooperwellnesscenter.com and you can order your protein shake.
21 grams of protein in 1 scoop.
Wow, that is a lot. Now this is a complete meal for breakfast. You could have it for breakfast. You could also have this for supper. All right, Chef, I think we should taste that and see how delicious this is.
It smells delicious.
That is yours and this is gonna be mine. All right, let's see. Very good, let's see what it is. Very good. So delicious.
This is a great breakfast.
Breakfast or even supper.
Great
Filled
way.
with vitamins, filled with omegas, filled with a lot of fiber. So for more recipe, visit our website, www.cooperwellnesscenter.com. And we'll see you again soon.
Yes, ma'am.
Thank you.
Yes, ma'am.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the wonder supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
Welcome back to Get Healthy with Dr. Cooper. Did you know that 90% of chronic diseases can be cured with exercise? Exercise is indeed medicine. Today we have medicine for you. Let me ask Ramsey. Ramsey, come along with your team.
How you doing, doctor?
Great. What do you have for us today? Go on.
Today we have a leg workout. We're gonna get this done really quick. Trying to get you guys to do this in the comfort of your home. Okay. Please distinguish beginner and advanced. If you're beginner, you're less than 6 months doing exercise. If you're advanced, you've been doing exercise for consistently more than 6 months, okay? We're gonna get into the basics of it. We're gonna go into a squat. Let me get you to do a squat real quick. Come up, all the way down, up. There you go. Okay, now turn to the side so you can see it. She's focused. Notice how she's going all the way down and all the way up. I really want you guys to go all the way down in a 90-degree angle on your knee. If you can go lower, push it. Again, this all depends on your ability of your body, okay? We want to do this maybe 3 to 12 times just to come on in and get you warmed up, okay? Now we're gonna go to advanced. The only thing that's different on advanced, again, we're going low, coming up, going low, and coming up, but we're throwing the hips forward, squeezing the butt. Go ahead and turn to the side. Now you're gonna notice that hip thrust. Boom. 1, 2, again, 3. Now for advanced, we want to do this a good 3 to 4 times, 3 or 4 sets of 15, okay? This one, again, you've been doing exercise more than 6 months, you should be able to attain it. You will be feeling a little bit tightness in your legs, so be careful with that. Next, we got a plank. A plank is gonna be, for a beginner, it's gonna be on your knees. You're gonna come all the way down to your floor, on your elbows, bring your hips down, hold. Right there, we're gonna hold 30 seconds, breathe, breathe, breathe. Again, if you have a cell phone right in front of you, put the timer, get 30 seconds in. After that, we're good. For advanced, now the knees are off the floor. We're holding, same thing. This should be attainable since you have been doing 6 months of exercise. So there's no excuses of not having the knee off the floor. Okay, focus again. We're gonna do this both 6 times, 30 seconds, total of 3 minutes. Total of 3 minutes, okay? And that's what we got for today. That's our leg workout. Now, Dr. Cooper, come on in.
Ramsey, thank you so much. Great job, everybody, great job. You know, you out there, make sure you do this 30 minutes to 45 minutes every day for 6 days a week.
Many diseases and poor health conditions that we suffer come as a result of not taking good care of our body. Dr. Donna Cooper Dockery is a certified internist that will take care of your health. Are you suffering from diabetes, obesity, high blood pressure, sleep apnea, chronic pain, or any other disease? Trust your health in the hands of Dr. Donna Cooper Dockery. She and her great medical team will take care of you. Call today for an appointment. She is waiting for you.
Welcome back to Get Healthy with Dr. Cooper. Today we have been discussing high blood pressure. As you all know, high blood pressure is a silent killer. According to American Heart Association, the death from hypertension is on the rise. How do you prevent yourself from dying from high blood pressure? Well, if you have not seen your doctor recently and you don't know your blood pressure, go ahead and get it checked. But also remember that living a healthier lifestyle can prevent, reverse, or cure many diseases. So I ask you to think about your lifestyle and see what you can change. If you're on medication for high blood pressure, there is hope. There is always hope. The Bible says in Philippians 4:6, "Be anxious for nothing, but in everything by prayer and supplication, with thanksgiving, let your requests be made known unto God." And I can assure you that He will be there to give you hope, give you encouragement, and help you to prevent or even improve your high blood pressure. And we are available. You can find us online at our website, www.drcooper.com or cooperwellnesscenter.com. You can follow us on Facebook, and we will always have information to give to you on how to live a happier and healthy life. Until then, have a blessed week, and I'll see you next week, same time, same station.